Good afternoon, everyone. Thank you for joining today. My name is Claire Petracki, and I am the Public Information Officer for Brown County Public Health. Today with us, we have Anna Destree, our Brown County Public Health Officer, with an important update on the county's health department's order. And we also have County Executive Troy Streckenbach. So we'll start with Anna.
All right, good afternoon. Earlier today, I was advised by our Corporation Counsel that my May 13th, 2020 order needs to be rescinded. Initially, it was believed by Brown County Public Health, in consultation with Brown County Corporation Counsel's office, that the order would be consistent with applicable Wisconsin state statutes. Based on research conducted during the last 24 hours and on consultations with outside legal counsel, Brown County Corporation Counsel is now of the opinion that the legal basis for the order is likely not strong enough to withstand legal challenge. Therefore, effective immediately, I hereby rescind my May 13th, 2020 order, and I make the following recommendations to the Brown County community in order to ensure health and well-being. 1. All county residents, especially those in high-risk categories, should continue to follow prior safer at home guidelines. And 2, that all businesses and other entities in Brown County should follow Centers for Disease Control and Prevention, or CDC, and Wisconsin Economic Development Corporation, or WEDC, guidelines prior to and after they reopen to the public. Brown County Public Health and I, as your local public health officer, will continue to focus on the health and safety of the community and continue the efforts to support testing, isolation and quarantine guidance and support, coordinated response efforts, and community education to control the spread of COVID-19. Even without an order in place, the public can and should continue the individual efforts that have made controlling the spread of COVID-19 successful. This includes staying home if you are sick, covering your cough and your sneezes, washing your hands often, and wearing a mask or face covering when out in public. We don't want to lose sight of the goal, which is to stop the spread of COVID-19 in Brown County. Thank you for all that you're doing out there. Stay healthy. And with that, County Executive Troy Streckenbach.
Thank you, Anna, and thank you, Claire. I just want to really iterate the most important aspect, that the health and safety of the residents and individuals who travel through Brown County, your health is priority number one for us. We really have to stress that businesses really adhere to the CDC guidelines and the guidelines that were put out by WEDC in order to create a fair, safe environment for both your employees and your customers coming in. Build that trust that individuals who want to patronize your businesses, that they can come in and be able to receive your services, but do it in a manner that is safe. We saw the numbers today. We had a fantastic turnout in terms of the community testing. The numbers that came in today as far as the positives were still very, in terms of what we were seeing last week, were in the right direction. They're lower. And it seems like Brown County finally has our hands and grips around this current virus. And I would just really strongly advise, as businesses look to reopen, make sure that you're following those WEDC guidelines and the CDC guidelines. It's really our way of making sure that we are able to, maintain and continue to beat this virus. As stated by Public Health Officer Destree, those who are vulnerable or chronic diseases that are most vulnerable to the COVID, our recommendation is to continue to adhere to the safer at home to protect yourselves. And lastly, I guess where we kind of talked about in the past, we really need to make sure that we continue to work as a community in prioritizing our efforts to make sure that we combat this overall. And hopefully over the course of the next few days or a week, that the state is able to bring forth some guidelines that the whole state can operate within. And at this point, I will turn it over to Claire for questions and answers.
Thank you, Connie. A reminder that next week's meetings will be on Monday, Wednesday, and Friday at 12 p.m. On the days that we don't have our briefings, we will send you the numbers via email around the same time at 12. Before you ask a question, if you could please announce your name and the outlet you're reporting from, and then who the question is directed to. I will now open it up for question and answer.
Hi, Rob Sussman, WTAQ. My question is for Officer Destry. Do you anticipate, after consulting with a legal counsel, issuing another order that might be able to withstand a challenge in court?
At this time, we are considering other options. We do know that there are the CDC guidelines, the WDC guidelines have a lot of good information that people can take to their organizations to work on, regardless of whether or not there's an order in place. So I guess what we're asking for right now is for people to start, looking at those guidelines, understanding within them. If they have questions, reaching out. And if they feel uncomfortable with what's in the guidelines and are not comfortable with opening, that they take the time they need to safely reopen. If they feel that what they're seeing, they wouldn't be ready.
Nate Phelps, Spectrum News, for either Anna or Troy. At this point, this is kind of a colloquial phrase, is the genie out of the bottle in Wisconsin? Is there any way to put these things back in, or is this pretty much it now and it's going to be follow the guidelines and go forward?
Well, I think as we stated the week before, and we continue to state that at this point, and based on legal advice, the really, in terms of any guidelines that are stricter than what we are able to do at a public health perspective here locally, is really going to come at the discretion of the state. And so locally, Officer Destry has the ability to target in where we may have an issue, but certainly, based on the legal counsel that we received in the last 24 hours, there is a lot of question in terms of a safer at home. So I would say right now, the most important thing is what Officer Destry mentioned was businesses and community members of Brown County. If you feel that, we're finally getting control over the current pandemic that's happening in Brown County with this virus, continue to exercise those important things, washing your hands, wearing a mask in public. With businesses reopening, please really take a look at the CDC and WEDC guidelines in terms of reopening. This is going to help us, again, flatten and keep that curve going downward. And that's ultimately our goal, is to try to get back closer to normal circumstances going forward.
And I would back that up. It's out because of the different rules that are existing in all the different counties and different areas. If we don't all have that same guidance to follow all the same recommendations, there's really not going to be an opportunity for us to come together and do what's needed to protect health. So we truly do need that larger statewide picture of how to manage something like this.
Ben Krumholz, Fox 11. Were you aware of any challenges that were coming, either Troy or Anna?
We certainly received a number of, I shouldn't say a number. I'm not aware of any legal challenges that were formally presented.
Any informal threats?
We had heard, if anything, positive statements. I mean, I know like the Tavern Lane had come out in support, understanding that this could extend some time to get businesses to prepare. But as far as legal challenges, no.
This is Haley with the Press Gazette. So just to clarify, Anna, does this mean that you will not be issuing the order that you alluded to, requiring businesses to comply with the WEDC guidelines?
That's correct. But what we are asking people to do is to still take a strong look at the WEDC guidelines and the CDC guidelines, because those do have very good steps in there, recommendations for how to keep your organization safe. The concern would be is if people do not take these steps, regardless of if there's an order in place, the risk to the business still is that you could get an outbreak within your facility. So I would still caution that people take this very seriously. Just because the order goes away doesn't mean that the pandemic stopped. It didn't. We're still very much in a COVID-19 pandemic. So I would urge people to get familiar with the WEDC guidelines, to look at the CDC recommendations, and still do what you can to protect you and your patrons, because like us in down the road, if an outbreak occurs, we don't want to be right back having to a conversation of closing because there's an outbreak in your facility.
This is Haley again, and I believe Corp Counsel is on the line, and if so, David, I'm wondering, without getting too into the weeds, I'm just wondering if you can kind of explain generally what changed in the past couple days, because you had said at the beginning that this seemed like it was going to be able to hold up.
Yes, thanks for the question. So the order came out on Wednesday. It basically ended any protections statewide that the governor or the health secretary had previously ordered. Our health officer was immediately and genuinely appropriately concerned that would lead to a flood of individuals going out into public, which we did see play out to some extent. And she appropriately wanted to stem that by issuing an order that would be in effect at least until the state and the including the governor's office and the health secretary and the legislature had a time to get together and act. At that point in time, in my opinion, it was reasonable what was ordered. She has the ability to order what's reasonable and necessary to control this pandemic. Now, once the governor and the health secretary and the legislature, once they met yesterday, I believe that was about 10 a.m., and then they came out of that meeting, and then it became clear that there's really just not much coming from that. Then our order was not, in my opinion, reasonable. Our order is only reasonable if it works or if it's likely to work. If we put an order in place that is like a soft quarantine order, where people are ordered to their homes, but they're let out for certain purposes, going to the grocery store to pick up medical supplies, if that's in effect for everyone in the state, then that can be effective. But our order, we can only order people in our county to do things. And because about a third of our workforce every working day comes into our county and then leaves our county, given that context, I no longer felt it was reasonable. And I don't believe, I don't believe it could withstand legal scrutiny because we'd have to prove that it's both reasonable and necessary. We can't seal our borders, and if other individuals are coming and going, no matter how much we lock down our own population, in my opinion, from what I saw, it just would not be effective. So I don't believe a court would find that a reasonable action on her part, and I don't believe it would withstand legal scrutiny. Now, again, the decision was issued. Our order came out within roughly 2 hours after that. I did have time to review the case. I noticed that the case analyzed a different statutory section regarding a different state officer. And at that point, it appeared we did have authority to do what we were doing. But you have to look at that authority with the circumstance and context that you have. In today's context, shutting down one county while neighboring counties remain open, again, I just don't see that as a reasonable and necessary measure. Going forward, our health officer will continue to exercise all the traditional health officer authority, including the ability to investigate, quarantine, isolate, perform tracing, those types of things. And there's also some other options available to our health officer under both state statutes and our county code regarding responding to this virus. Most of those responses, though, as opposed to being on a county-wide basis, would be on a case-by-case basis. If there's an individual that requires an order to be in place, she has the authority to do that. If there's a certain facility that requires action, we have options in that regard. But the countywide aspect of this order, without having similar regulations throughout the state, again, just doesn't appear to be effective, doesn't appear to be reasonable, and I don't feel we'd be on strong legal footing taking that case forward. I also would like to clarify the Wisconsin Counties Association. It's been being said by different individuals in the state that they indicated counties could not do this order. I just wanted to clarify that's not their position. They never said, the WCA, that the Supreme Court order prohibits counties from taking this type of action. But my read of the general analysis they provided was that it appears taking such action would be on legal footing and likely wouldn't sustain judicial scrutiny.
Quick follow-up for Dave. It's Doug from the Press Gazette. Happy Friday. The legal issues with this, are they likely to affect other counties that have put local safer-at-home orders in place? There were a lot of them in this region and in the Fox Valley that followed our lead.
Sure, thanks, Doug. And yes, I am glad it's Friday. Regarding other counties' orders, I'd have to see what they say. I think the Supreme Court case, again, given the current context we're in, it does limit the authority some other counties have. But again, there's differing, varied opinions. It can depend exactly on what's being ordered and what the context that order is issuing in. I feel that Supreme Court decision made it difficult for counties to take drastic action to prevent, control, and suppress this virus. And I believe the only way appropriate action can be taken would be on the federal or state level.
Anna or Troy, this does not affect the Oneida Nation Safer at Home, correct?
That's correct.
It wouldn't count for De Pere either, correct?
Have you talked with De Pere? Are they planning on rescinding theirs, the Oneida Nation?
We have spoken with them, but I would recommend reaching out to De Pere for that.
Have you folks done anything to communicate this to the business community at this point, or is this your first stop?
I think this is the first of many steps we have to communicate this.
Are you concerned about the health of the community, considering, just yesterday you said these extra days are needed to prepare the businesses, and you're doing this on a sunny Friday afternoon when we've been, pretty much safer at home for 59 days, 2 months now?
Yeah, of course I'm concerned for the health of the community, and I think that's why making sure that we educate people on the WEDC guidelines, WEDC guidance, the CDC guidance, educating that it's okay to wait to open if you're not comfortable opening. That's another thing. We've heard from a lot of people that just because they can open doesn't mean they're going to open right now. So I do think that there will be people that will wait to open when they're comfortable, and that's great. I do think that a part of we talk about media as really being a partner at times, and I think this is an opportunity where the media can truly help us with sharing that message. It's one of those times that the more people we can get to know that, hey, now more than ever, it's important that we take these measures in place, because we're going to open up. We want to open up successfully, and we don't want to be right back here in a couple months. So in order for us to succeed here, we all got to do our part. We all got to maintain and do the CDC guidance and continue to do those things, and hopefully we succeed.
Are there any further questions for Public Health Officer Anna or County Executive Troy or myself? All right, have a good weekend, everyone. Thank you for joining.